everyone, I'm Sarah Dobeck. I'm one of the prevention specialists for CMSU, which is the single county authority for drug and alcohol programs for the counties of Columbia, Montour, Snyder, and Union County. As such, we were tasked by the Department of Drug and Alcohol Programs for Pennsylvania with completing our county prevention needs assessment. This is going to be an overview of those findings, and basically it's going to give you a look at what substances are truly being used by those in our counties and what is kind of influencing that, some of the factors that are going into that use, and some of the programs and prevention programs that are already being used for that, and some of the things that we are looking to do in the future. I'm going to try to keep this brief, as I know a lot of you will be viewing this virtually. Oh, and also we will have contact information at the end if you'd like to contact us or have any questions about this. Okay, so this slide is just a basic overview of the process that we did. So this is all data driven. Everything comes from data from a variety of sources, including the PAYS surveys, some of our local law enforcement data, the Department of Drug and Alcohol Programs data, and a variety of other sources. So this helped give us a greater understanding of the substances being used or misused, as well as the related socioeconomic, health, and other negative consequences. It also helped us to identify specific risk and protective factors most impacting substance misuse within our particular counties. So this is county specific. And then we also worked at engaging key stakeholders in data-driven discussions. So we did hold some different discussion groups and things like that to contribute to this assessment as well. So first, looking at what are the youth problems, and this is again data driven. This is what the youth themselves are reporting, typically from the PAYS survey. Youth consumptions in order. The first one is 30-day alcohol use, and that 30-day means that they've used within the last 30 days. So those that are using more frequently. Number two is the 30-day vaping or e-cig use, and then last 30-day marijuana use. And of course, as these students get older, it tends to impact them more, with 12th grade reporting the highest use of all substances. Youth consequences that were identified: DUI arrests for underage drinking, alcohol-related crashes, illegal drug-related crashes, and possession and sales within schools, specifically tobacco and marijuana violations. Adult consumptions, and this was one really stood out, so that's what we focused on, and that is alcohol consumption for adults. That is by far the substance that is having the largest impact on the largest amount of individuals as adults in our counties. We all know, there's a lot of discussion around the opioid, methamphetamine use, things like that. However, alcohol is by far the largest impact on the greatest amount of our population for adults. And when we look at adult consequences in our counties, alcohol use can impact DUI arrest rates, and impaired driving, of course, can lead to an increase in arrest rates and alcohol-related crashes. So why are the problems occurring? And again, data-driven, this is coming directly from the youth surveys that the youth took. They're identifying the risk factors for their use as, number one, the perception of drug use. Their perception is that it's not necessarily a negative thing. It's not necessarily a risky thing, so their perception of it. Number two, laws and norms favorable toward drug use. We know when we make something legal, when we legalize something, the youth feel that that is safer, it's more acceptable, so the use goes up. We've seen this with states that have legalized marijuana recreationally, that the use has gone up. Number three, parental attitudes favorable toward use. Again, this is right from the youth survey. The youth are saying, my parents don't mind if I use alcohol, use marijuana, use vaping. In fact, they feel that the parent attitude is favorable towards this. Number four is depressive symptoms, and that's where we're seeing that kind of self-medication of mental health that maybe isn't being addressed, and they're using substances to deal. And then last, favorable attitudes toward use appear to increase with age. And again, as they get older, the youth are reporting that it's more acceptable for them to use well, you're 18 now, so yeah, go ahead and drink, or things like that. The protective factors, so the things that keep our youth from using these substances. And this, again, is data driven from the youth themselves, from the surveys. Number one, the biggest thing that youth are saying keeps them from using substances is family opportunities for social involvement. So when they're spending good time with their families, that's keeping them from using substances. Number two, right behind family, is school opportunities for pro-social involvement. There's a lot of times where you have, after school activities, sports clubs, things of that nature. And then last, we're right back to the family again and family attachment. So how close youth feel to their family, they're saying directly impacts whether or not they may use substances. One thing we want to point out is that our protective factors, so the family opportunities, the school opportunities, and the family attachment, are all lower than state average according to the PAYS. So we do have a little bit of work to do on that to get these to at least the state average and hopefully a little higher. All right, so again, looking at the why are the problems occurring, so these are what the PAYS survey is indicating. Number one, that alcohol and marijuana have the lowest perception of peer disapproval, parental disapproval, and perception of risk. So youth are saying, if I use alcohol and marijuana, it's okay with my peers, it's okay with my parents, and I don't really think it's that risky. Number two, youth believe it's very easy to obtain these substances. So they're saying I typically get it from friends, from siblings, or from parents' friends. Other risk factor data, the number one is that youth are self-medicating to address mental health concerns and cope. So there's where some of those things that we're doing in the communities for youth mental health is very important, and it's going to impact the substance abuse that we see by youth. And then two, family management issues. So putting it all together, so here we have, and in no particular order, the risk and protective factors under these problems. So problem one, we focused on the adult consumption of alcohol. Risk and protective factors, number one is the attitudes towards risk. So they're, again, not thinking alcohol use is very risky. Number two, mental health. Again, self-medicating, and we're seeing that for adults as well as youth. And then three, social norms. In our counties, alcohol use does tend to be a very normal thing in social settings. Problem number two, moving on to the youth vaping. And, it appears to be a rising consumption, which I'm sure most people will not be surprised by. The risk protective factors there is that number one, perceived risk of drug use. Again, youth aren't looking at this in a particular risky way. And then two, perceived availability. They're saying it's easy for them to get this. Problem number three is the youth alcohol consumption, and the risk protective factors, again, perceived availability of the drug. They're saying I can get alcohol pretty easily. Parental attitudes favorable toward use. And I know probably some of you guys have heard, well, I'd rather them drink at home than, drink somewhere else where I can't watch them or don't know if they're safe, or, well, we all did it in high school, so it's a normal thing, and so on. So kids are hearing that and they're thinking it's a favorable attitude towards their use. And then the last thing, of course, is the perceived risk of drug use. Again, youth aren't thinking this is a very risky behavior to do. And problem four, youth lifetime marijuana use. And again, risk protective factors, perceived risk of drug use. Two, laws and norms favorable towards drug use. That's where the youth are identifying. You guys are looking at, society's looking at legalizing this stuff. And so to us, that kind of signifies that it's safer. And then last one, parental attitudes towards use. Why are the problems occurring here? So this is where we looked at a lot of community conversation. We had a lot of focus groups with youth in the different schools, with some of the county coalitions, with law enforcement, with a lot of different individuals to look at some of the specific contributing factors for our area. Okay, so here is where we're going to kind of put it all together and look at the logic model for each problem. So problem one is the adult consumption of alcohol. And again, looking at those risk protective factors, number one is the attitudes toward risk, and the specific contributing factors towards that attitude towards risk for adult alcohol in our counties is that adults are reporting it's widely consumed. It's not seen as being harmful if you know your limits. Culturally acceptable, it's at most social functions. Most of our weddings, graduation parties, birthday parties, most of our things around here, even going out for dinners, things like that, alcohol is typically involved. So, and last, they're saying easy to get, sold in grocery stores, bars, restaurants. That has increased in our counties in the last couple of years. Now they're sold even in gas stations and things like that. The second risk protective factor for adult consumption of alcohol is the mental health, and the specific factors they're talking about multi-generational use, where my parents used it, this is just normal, it's a thing in my family, this is what we do. Untreated mental health, so they're using this to cope because their mental health is not getting treated. Again, kind of going along with that, used to cope with stressors or mental health. So stress, I've had a hard day, I'm going to go home, have, a drink. And lastly, lack of recreation or things to do that are alcohol free. And these are adults that are reporting this. I think this also goes along with the youth, and you'll see that in the upcoming slide that, our county, people who live in our county are looking for other things, recreation to do that do not involve alcohol. And lastly, the social norms, it's widely consumed and accepted, not seen as risky, again, as, know your limits. And a lot of people believe it's a rite of passage to drink from your high school years on up. So looking at the logic model for problem number 2, and that's the youth vaping. Don't have a ton of data on this because it is a newer thing, but the risk protective factor, perceived risk of drug use, contributing factors. Youth are identifying they're seeing the vaping as less harmful than cigarettes. The youth believe that most kids are, and they said specifically juuling, socially accepted by youth, and youth perceptions of risk, they don't see that it's very risky. Second one is the perceived availability of drugs. So the parents see it as a better alternative than cigarettes, so they may be getting it for their kids at times. Easy for kids to get from friends, or some parents will get it, and also, of course, those online sales. The logic model for problem number 3, which is our youth alcohol consumption. So again, looking directly at those risk and protective factors. The risk, perceived availability of drugs, the alcohol is not viewed as risky. Youth perceive that most youth are drinking in high school. Some youth drink because there's nothing else to do, they're bored. There's where you see that correlation between adult and youth. And then use alcohol to cope, stressors, anxiety, and or depression. Parental attitudes toward drug use, so that's the second risk factor. Again, the contributing factors, some parents see youth drinking as a rite of passage, alcohol available in the homes and easy to get, and a general lack of parental monitoring and some allowance of underage drinking. So that's where you have I'd rather at my house, or things like that. And then the last one, the perceived risk of drug use for alcohol, and the youth perception is that it is not risky. Last one, the problem number 4, the youth lifetime marijuana use. The risk factors, perceived risk of drug use. Again, contributing factors, youth are saying they don't see it as risky. Some youth use with family members, and that's what the youth are reporting to us. Risk factors, the laws, norms favorable toward drug use. Again, we're seeing some of that multi-generational use. My parents did it, this is just normal for me. Easy to get from family and friends. And also they're believe that it's not a big deal since it's going to be legal soon. Last risk protective factor is the parental attitudes towards the use. Some parents allow youth to use in the home. Parents view marijuana as not as bad as other drugs. Well, it's only marijuana, at least it's not this. And some are saying they believe it's a rite of passage. I did it in high school, my kid's going to do it in high school. So resource assessment, what is already happening related to these risk protective factors and our contributing factors within our specific counties? So problem number 1, the adult alcohol consumption. So we're going to break it down in between strengths and gaps. So strengths, we have a lot of collaboration in our counties, something we do really well. So specifically, amongst community partners, coalitions, and our schools. CMSU and community partners coalitions offering educational events, recovery events, and recreational sober events throughout our counties, sobriety checkpoints and educational materials by local law enforcement agencies, and CMSU continuously offering DUI education classes, level of care, and DUI assessments. Some of the gaps or challenges for adult alcohol consumption: limited amount of prevention options for adults. Primarily, it's intervention or treatment options for adults. Prevention is typically more focused on youth. So another one, improved collaboration for prevention programs, specifically with local law enforcement efforts. And then, of course, and this we're going to see over and over again, is that there are limits to funding, to time, and manpower for prevention programs. Problem number two, the youth vaping. So strengths as far as our counties go: CMSU prevention specialists working in the schools and offer programs to students, parents, and the community. Some of these programs include In-Depth, This Is Quitting, and Catch My Breath. Evangelical Hospital offers an educational program on vaping to students, parents, and the community within our entire CMSU coverage area. Current programs, those that we just talked about, are sustainable based on the cost and the fact that prevention specialists are embedded within the local school districts. And lastly, CMSU is available to assist school districts in policy and procedure changes with regard to vaping in schools. The gaps or challenges: one of the main is that parent and or student buy-in to participate or actively engage in these programs. I'm sure some of you have gone to some of these sessions out in our community and saw that they were not overly well attended at times. So trying to get people to buy in and participate. And then with the continued demand on school districts, finding available time and resources to implement within the school setting can be difficult. There's just so much demand at this point on school districts for all different types of things, the testing and all those different factors that go into that. Okay, so for problem 3 and problem 4, they have the exact same strengths and gaps or challenges, so I'm going to review both of those together. So problem 3, just as a reminder, is that youth alcohol consumption, and then problem 4 is the youth marijuana consumption. And the strengths for both of those is that there are multiple agencies offering Too Good for Drugs, which is an evidence-based program, to all schools within CMSU coverage area. CMSU provides SAP, which is the Student Assistance Program, liaison services to all school districts in coverage area, which includes screening and referral assistance. We also provide school-based intervention services, such as the evidence-based Teen Intervene. So if a student gets referred to the SAP program for substance issues, mental health issues, any of that, a screening can occur right in the school with a SAP liaison, and the referrals can happen within that setting and get that student the supports they need. Again, or school-based intervention services can also happen. Moving on, the full-time prevention specialists provide multiple ATOD prevention, education, and awareness events in the school and community throughout the entire year. Just a few examples of that are Red Ribbon Week or SAD clubs. And then again, collaboration with local agencies such as county coalitions and school districts within the 4 county coverage area. We do very well with that within our 4 counties. So the gaps and challenges with both the youth alcohol and the marijuana consumption. So again, getting that student and or parent buy-in for services and programs offered within the continued demand on school districts. Finding available time and resources to implement within the school setting can be difficult. And lastly, just the general transportation and or availability for students to be in after-school programs also is a challenge. So looking at our next steps, this needs assessment, the prevention programming that we're looking at addressing the risk and protective factors within the next 5 to 6 years, and the long-term goals, the actual true problems, within 10 to 12 years. So what we're looking at just continuing to do moving forward. So we're looking to implement additional evidence-based programs in both school and community settings, focusing again on the evidence-based programs, collaborate more in depth with local law enforcement and other community agencies that are offering prevention programming, and lastly, improving our current monitoring for existing or newly implemented programs to ensure greater effectiveness. So just making certain that the programs that we are spending the time and effort to do are truly being effective, and making sure we're monitoring that in the best way possible. And that concludes our presentation on the county needs assessment. We appreciate your time. If you are a community partner who is interested in collaborating on these efforts, or are already implementing programs within our counties that meet these needs, we would love to hear from you. Please reach out to the CMSU Prevention Supervisor, Allison Wilson. There is her contact information there, her email, and her work phone. And I do just want to mention Allison oversaw this entire project and did a lot of work for it, and she did a great job. You're also welcome to reach out to myself. I know a lot of you know me through the different county coalitions, my work with the treatment courts, and things like that. So there's my email, and you are welcome to reach out to me as well. Again, I'm the prevention specialist with CMSU and also Southern Columbia School District. I also just want to mention that there were 2 more individuals who really helped with this project, and that is Kelly Ann Pegg, who is prevention specialist with CMSU in Bloomsburg School District, and Jen Wright, who is a prevention specialist with CMSU in Benton School District. So again, we would love to hear from you. We really appreciate your time in watching this presentation, and I hoped it was worthwhile for you and that you picked up on some things that you feel you can utilize in the future. All right, thank you everyone.